Greetings. My name is Tony Flood. I am a professor of philosophy at North Dakota State University. I appreciate the opportunity that APPE is giving me to do one of these flash presentations. I wanted to talk, the title of my talk is Public Policy Concerning COVID-19 and the Principle of Double Effect, Some Considerations. I worked up this abstract and thinking about this project back in the summer before the vaccine. And so some of the dynamics that I'm going to talk about hopefully are becoming a thing of the past. But I think ethical reflection on this particular case can perhaps help us in the future, future pandemics, anything involving infectious diseases and the like. So I will sort of present it in the terminology of COVID-19 and the considerations pertaining to that, but obviously the ethical considerations go beyond. So there were a couple suggestions, particularly in the early days of the shutdowns and things of that nature, concerning how do we build up herd immunity the fastest? In other words, how do we get back on track? The vaccine at that time was months into the future, if not a full year. How can we do it without a vaccine? And one of the suggestions that made its rounds was, well, if we can just get a sufficient number of the people of the population basically infected and become therefore immune going forward, that will help to build the herd immunity. And who better than the young? The infection rate, or at least the mortality rate for COVID with respect to the younger populations was fairly low. So it was considered, well, let's get school-age children, back going, college age, build up that herd immunity that way. And that tended to be rejected. That wasn't the approach that people took. But I think it does merit some further reflection. Why would you be tempted to do this? Well, number one, you got to build the herd immunity to get society back up and functioning. So that's what we're going for here. But anything beyond that? Well, yeah, if you're taking the line, there is just no harm to the people in question, to the segment of the population that you're exposing, in effect, the disease to. If there's very little harm, then what's the fallout? What's the risk? And secondly, even if there were some harm, the proportionality would seem to say, if we're getting all of this great good at this minimum of bad effects, let's just go forth with that strategy. I think there's problems with both of those proposals there. I think number one, there were sufficient harms to the segments in question that we might want to reconsider that policy. Not only in the sense of, yes, if you contracted COVID-19, and again, this would be analogous to other cases, you have the risk of, getting serious health issues, lung issues and things of that nature, and mortality is a possibility. But secondly, obviously, with any new disease, there's unknowns, right? We just don't know what the long-term consequences might be. They may be nothing, but they might be significant as well. And so to just go forth as if there's no real harm here, I think is problematic. Now, I do think the proportionality thing needs to be looked at. That's the second reason why we would do so. But I'm going to offer a suggestion here. Number one, I think proportionality cannot be the fundamental consideration. It needs to be tempered by some further considerations. And what is that? Well, number one, the Kantian Principle of Ends, I think applies here, that persons are the sort of thing that where you just cannot reduce them to a mere means, even for a good end. It just violates personal dignity to use a person as a mere means. And I think that's what would have taken place here. Why do I suggest that? Well, particularly school-age children, but even adults who, workforce, college age, young adults. I I don't know that they would have consented to that. I mean, school-age children, I don't think would have even had the opportunity to consent, and even the young adults, it would have been very hard to have a system of consent, right? So in effect, we would just be using them. And I think that's a problem. So if the Kantian principle of ends is right, and I'm assuming for the sake of this presentation that it is, the strategy of using any segment of the population in this way would be problematic. So what do? Can we use some sort of proportionality going forward? I think yes, and I think that's where the principle of double effect comes in. It's part of the title of the paper. So the principle of double effect, of course, is the traditional moral principle, kind of a procedural principle that enables us to grapple with situations where we're looking to accomplish some good effect, but we know there's going to be bad effects. They're foreseeable, they're there, we know they're there. So how do we proceed? And the principle of double effect is generally subdivided into 4 subconditions, 2 of which I'm going to talk about. Because the first one links up directly with the principle of ends, and then the second one is going to be proportionality. So the first is the principle of double effect says no action that's intrinsically problematic can be pursued. So in this case, what would that be? Well, that would be the Kantian principle of ends. You can't reduce a person to a mere means. That's just taken off the table. So any strategy, any approach we're going to use that would violate personal dignity, that would eliminate these strategies that we were talking about of using school-age children for the sake of building herd immunity. Now, the second subcondition that I think is particularly important is proportionality. So we're going to allow proportionality into our moral thinking, but it's going to be tempered by, in effect, the principle of ends in this case. So yes, we can pursue a good effect and even allow a bad effect, provided that it's proportionate, right? You can't have such bad effects that they would outweigh the good effects. And again, we're talking about what's rationally foreseeable here. There's always unintended things that just cannot be accounted for. But in terms of what's rationally foreseeable, we can still use proportionality to clarify what approaches are going to work. And so this doesn't really lead to any particular suggestion, but I think it does lead to a framework for how we navigate these situations going forward, that no matter how desperate things get, personal dignity has to remain central, but that doesn't mean all options are off the table. We can tolerate bad effects, and that may very well be, in terms of public health decisions, certain segments of the population, there might be deaths, there might be things of that nature. Okay, that's going to happen, particularly in a country with millions of people. But if those are merely being tolerated and not being used as the means by which we accomplish some end, then that's going to be the guiding principle. So those are the key ideas here that I think are relevant to looking at this very large and very complex issue. And I appreciate your time. Thank you.